The state is facing a looming nursing shortage. The numbers show that we could be down 25,000 nurses by 2036. The problem's not a new one, but there hasn't been a real solution. Joining us right now is Peggy Farrell Dangerfield, president of the New Jersey State Nurses Association, to talk this through. Peggy, thanks so much for being with us. We've known about this shortage for years, but can you just help us understand how we got here?
Well, nurses make up the largest segment of the healthcare workforce, and we have known this is coming for a while. And as you said, HRSA has predicted a shortage in New Jersey of over 24,000 nurses by 2036. And this
HRSA
shortfall,
being, sorry to interrupt you, but
the
HRSA,
Health Resources and Services Administration.
go ahead.
And so we know that this will affect the healthcare needs of our residents, and there's only a few states that have a worse shortage predicted. So we knew this was coming for a while, but of course, COVID-19 exacerbated the issue. The pandemic made us look at the nurses who were working, and many left the profession, many retired at that point, and it made it an even more critical issue for the nursing shortage. We also in New Jersey have an aging population, and we know that as our residents age, they have more need for healthcare services. And our nurses are also aging. So our nurses are retiring, and that contributes. We have high burnout rates. In New Jersey, nurses face both burnout and stress, leading sometimes to early retirement and oftentimes to career changes.
Let me jump in there,
So,
Peggy, and just ask you, you said that there's an impact on patients, and we talk about this sometimes from a statistical point of view, right? 25,000 by 2036. But what is the impact on patients if we get to this 2036 year and we haven't closed this gap?
well, without the nurses to staff, let's start with bedside nursing. Without the nurses to staff hospital systems, the patients are getting older. They are more ill than when I started. The acuity is higher. And with less nurses taking care of those patients, there's issues with their care and with setting priorities. So nurses do have some moral distress with prioritizing the care and being able to give the care that they need. So we need to look at staffing, and we need to understand that staffing affects both patients and nurses. So studies have shown that adequate staffing in hospital systems lower morbidity, lower mortality, reduce readmission rates, reduce errors, reduce infections, falls, and those things. And for nurses, it reduces burnout and stress, it reduces turnover, and it also reduces physical injury.
And that burnout and
So,
stress ends up becoming just a snowball effect, right? When you already have a shortage and then you have nurses leaving because they're overburdened. Let me just ask you this. We see that there are a number of responses, both from hospital systems like Barnabas Health that is just opened or developing a new nursing school. And then there are legislators who are crafting legislation. I want to ask your opinion. What are the appropriate responses here? What do you think actually solves this problem?
so we always look to our legislature with the introduction of bills that support things. And I know that if you want to look at both past and current legislation, one thing that was done in 2024 was we have a nurse loan redemption program, and that helps with the nursing faculty. So another issue with the pipeline for nurses is to ensure that we have nursing faculty. And that law did increase the amount that a nurse faculty can redeem up to 50,000 over 5 years. So that was
So that they're
important.
less burdened with debt when they do end up entering the field. And
Exactly.
and just a
But
few
but
seconds left, if you could just tell us what else you think is a great solution here.
academic practice partnerships where colleges and university partner with hospital systems to ensure that there are clinical placements for nurses as they come through their educational program. Our safe staffing and patient protection bill, which is in the legislature right now to
Yeah.
mandate nurse-patient ratios so that we don't have that moral distress and we have adequate staff to care for our patients.
All right, Peggy
Um,
Farrell Dangerfield. I'm so sorry we have to leave it there, but I appreciate you coming on and
okay.
sharing perspective with us. Thank you.
All right. Thank you so much.